So we're super excited to have this procedure back at Imagen. This is our core Intima. It is laser vaginal rejuvenation treatment. Basically what it is it uses laser energy to resurface the internal and external structures of the vagina, helping to increase your collagen, helps tighten things up a little bit, improves your sensation, and helps with stress urinary incontinence as well. This is the internal probe here. It's got, it has a mirror inside of it, and so the laser comes down this way and out through this little window. And basically, the way that the treatment works is this goes inside, and then we treat and turn it. It turns around and around and around. So we do treatment all the way around, and then we pull it out a little bit, and treat all the way around, and then pull it out a little bit, and then treat all the way around. And that way, you can treat the entire internal surface of the vaginal canal. Okay, so then the outer handpiece looks like this, and the laser just comes out the end here, and it's basically just a stamp treatment, just like what you would do if you were doing your face. And it helps to stimulate collagen production and resurface it. It can also help with pigment issues if you have dark spots from shaving or waxing, or sometimes get some dark pigment in there. This can help clear that up.
So for prepping for the treatment, we will want you to shave prior to coming in because it just makes for a better treatment, especially treating the outside. So, and then we will put some numbing cream on the outer areas of the vagina, and we'll put saran wrap over that just to make sure it gets nice and numb. And you'll be sitting there for about an hour with the numbing cream on. And then we will use ice after the treatment.
The actual treatment itself is really not uncomfortable at all, especially the internal part. You feel it moving around. The actual pulse of the laser, if you feel it at all, it feels a little bit like a quick menstrual cramp, just kind of a crampy sort of feeling, but not bad. And that's with no numbing at all. You really don't need numbing on the internal portions. The external portions, if you feel it at all with the numbing, it feels a little bit warm. But it's not, again, with the numbing, it's very tolerable. And the whole treatment is really fast. It takes about 2 minutes to do inner and outer all together. It takes you longer to get that than it does to actually do the treatment. So right after your treatment, a lot of patients will notice an improvement in urinary incontinence almost immediately. So right after, you'll have some swelling, and that'll give you almost complete resolution of any urinary incontinence that you have. But then with a week or two of time, that swelling will come down and your symptoms will really come back. So then what happens is your body builds up collagen, and as it builds up collagen, that's when the actual results of the treatment come in. So usually what we recommend is to do treatments a month apart. Most patients, it's probably 2 to 3 treatments initially, just depending on how bad your laxity is, how bad your urinary incontinence symptoms are. And then after that, we do a treatment once a year. So the reason that you want to do your treatments close together at the beginning is because each treatment is going to kind of ramp up your collagen production. And so if you treat and you get a bump up in your collagen production, and then you treat again while it's still high, you're going to get another bump, as opposed to treating, waiting for it to come back down, and then treating again. So you'll get a better collagen response if you do them kind of stacked up. You're going to continue to age, and so doing a memory treatment once a year is just going to keep you from having to do the stacked treatments to restart the whole process again.